All right, we are on. Welcome, everybody, to this week's episode of Weekly Dose with Dr. Uday. I have Dr. Mitra here with me. And actually, Dr. Mitra, I forgot to ask how you would like me to refer to you. So if you want to let me know.
Dr. Mitra is fine.
Dr. Mitra, okay. Well, very good, guys. Dr. Mitra is spending some time with us today. We're going to be talking all about cataract, and she is going to be giving us some nice little tidbits about this. So I'm going to start with introductions. For those that don't know me, my name is Dr. Uday. I'm a board-certified family medicine physician. I'm based in Martinsburg, West Virginia. I co-own a primary care practice, namely Apple Valley Family Medicine. I am located in Martinsburg, West Virginia, and I also provide aesthetic services to my patients and clients. And with both modalities, my goal is to have my patients feeling and looking good. So, Dr. Mitra, I am actually going to turn it over to you to introduce yourself because I'm pretty sure you're going to do a way better job than I would. So, go for it. But welcome.
Thank you. Thank you for having me. I'm really glad to be here to talk to your patients and our audience about cataracts. My name is Mitra Ayazifar. I'm an ophthalmologist in private practice in California. I have two locations, one in Northern California, which is in Grass Valley, more rural setting, and the other one is in Roseville. And I was trained in general ophthalmology and basically trained further for oculoplastics and, functional and cosmetic lid procedures. My practice is called Capital Eye Medical Group. This is where we partner with patients to develop their best vision possible so that they can live life fully and enjoy their hobbies for years to come. And they know, yes, and they know when they enter our doors that we treat more than just their eyes. So,
Absolutely. Great. Yay, yay, yay. So let's get started. So Dr. Mitra, what is cataract?
So a cataract is not a disease, right? It's a condition that I tell my patients, if we live long enough, and we're lucky to live long enough, we're all going to develop it, right? At different points in our life. So essentially, cataracts are your natural lens. So you're born with a natural lens in your eye that focuses the light beam, where it needs to go, and it allows the light to pass through. And with time, this clean window or clean lens becomes a little more cloudy as time passes by due to different conditions, due to different things. And so what happens is we keep, having our prescriptions possibly change. We keep getting a new pair of glasses, and it gradually gets to a point where the glasses may not be helpful, but it is something that simply needs to be monitored and treated when the time is right.
Absolutely. So what would you say are the symptoms of it?
So the most common is that when patients go to their eye doctor, they get a new prescription, or they realize that, I'm not able to drive at night the way I used to, or even when the light gets a little bit low, when the headlights come at me, or even regular lights deflect in different directions. Things are just not as clear as they used to be. And the glasses help, but I keep turning on more lights in the house, or when I read, I have to have a lot more light pointing at what I'm working on. So those are some of the more common symptoms that happen.
Gotcha.
And it's very gradual, very, very gradual.
Gotcha. And formally, how do you diagnose it?
So obviously, preventive measures or, just regular eye exams are most important. So making sure that patients, especially if patients have been wearing glasses, regularly, that they are following up on a yearly basis with their eye doctor. Now, whether that's an ophthalmologist or an optometrist initially, it has to be someone who's aware of your baseline, aware of whether or not there's family history of different diseases or different conditions like diabetes, macular degeneration, or high blood pressure, things like that. You want to have those yearly eye exams so you'll know, your eye doctor will know whether things are changing and whether or not they're able to correct your vision with glasses or contacts or whatnot.
Absolutely. So how do you treat this?
So the main thing is controlling what we can control. Like I said, I tell my patients this is something that all of us will develop. And what we try to do is do the things that are under our control. Go to your eye exams. Make sure that, smoking is, some lifestyle changes may not be helpful. So smoking, increases the progression. Controlling your exposure to UV rays, so sun exposure. When you go outside, even if it's not sunny, if you're living in high elevation, when you go outside, wear sunglasses. UV rays, kind of speed up the process of developing cataracts, and it is one of the risk factors for macular degeneration as well. So making sure that you do that. Some of the conditions that you have, diabetes and hypertension, with the help of your primary care doctor, obviously, making sure that those are controlled, that you're following what you need to control that. And if you're on medications like steroids, prednisone for different conditions, that can speed up the process of developing cataracts as well. Different type of cataracts, but they can develop faster in younger patients, sometimes in their 40s. That can develop. So making sure that you're, doing that. So let's say, as far as treatment, let's say it gets to a point where your eye doctor or ophthalmologist notices that, it's hard for me to look towards the back of your eye, or you're a high functioning person, or even the things that you want to do, your daily activities, you're having trouble doing them. That's the time to really treat that. Making sure there aren't other things that need to be treated. So glaucoma, macular degeneration, they can also be a part of, causing the vision changes. But getting rid of this film or filter that's blocking the light from coming through, that's going to be helpful. So essentially, when that time comes, how I discuss it with the patient is that this, dirty window, there's no way to wipe it clean. This cloudy lens. The only way to get rid of it at this point is to remove that cloudy lens and replace it with an artificial lens, which will help you see.
Absolutely. And I can't tell you how many patients that after they've had it done, they're just like, man, I should have done that sooner, doc. I'm like, I told you so.
I know.
So yes,
I know.
absolutely.
Yes. And sometimes, to be honest with you, Dr. Uday, I would probably
Yes.
tell your patients, and my patients as well, every once in a while, close one eye and see whether both eyes are functioning the same. Some of them, especially with the younger cataracts, they're shocked that one eye is not seeing as well as the other one. So they don't realize it because the other eye has been pulling the weight.
That's true because you have both you're using. So, the other one is compensating. I got you.
Correct.
I got you. So, guys, you heard it. So, definitely make sure that you're making it for your eye exam, your regular eye exam, and then obviously taking care of yourself. You know the things, but it's obviously easy to do and easy not to do. You try to avoid smoking. There's so many other issues that can give you, and we always try to encourage you to keep that in mind. Eating healthy, and then make sure that you're taking your medicines. And a good one is the wearing shades or avoiding UV light. That one I actually don't tell my patients. I'll definitely start doing that.
Yes.
I'm actually going to switch gears and I'll ask a couple of questions more geared towards you. So I always ask, why do you do what you do? So I'm going to ask you that question. Why do you do what you do, Doc? So
that's very interesting. I when I was younger, I thought I chose ophthalmology. Now that I look back, I think ophthalmology found me, doing eye surgery. And initially, when I was doing my rotations, and you're most familiar with this as well, third year of medical school, we do our rotations. It's the major. I think I had psychiatry, I had internal medicine, I had OBGYN, all of these, and I loved every single one as I went through. Beginning of the fourth year, had my subspecialty rotation for surgery. So it was ophthalmology was first 2 weeks, and then it was I think it was urology and neurosurgery. When I did ophthalmology, it just combined everything that I wanted to do. So it was surgery that was delicate. It was having long-term relationship with my patients, meaning like follow-up care and really seeing them for other diseases or other eye conditions, that I would see them long term rather than do the surgery and they will be gone. So I would establish a connection with patients, but also having a lifestyle that's conducive to having a family life and all of that. And I was so overwhelmed by, let's say, internal medicine, family practice, because it felt like I'm just going to go home and I'm going to wonder, did I, all of these things that I have to know. I thought 2 eyeballs. How much is there to know about 2 eyeballs? There's a lot. There's a lot.
I love it. I love it. That is so good. And the funny thing is, the reason I picked family medicine is I just can't stay on one thing. It's actually the opposite. Like it's like a box of chocolates. You just never know what you're going to get. And I actually like that. But that is really, really good. So, and then I guess the other one on the flip side, the other question I always ask. So with all the experience that you've had, and all the life you've lived so far, if you got a chance to meet your 20-year-old self, what would you tell them or what would you advise them?
Ooh, 20-year-old self.
And this one is always good.
Yes, it is. It's absolutely good. I would say that not to worry about the next, degree, the next, thing that maybe society expects of you, right? I would say life is too precious, and enjoy each moment, live in the moment, not that you forget about long-term goals, but appreciate the people that are around you, because, especially time goes by so quickly, right? And I think we forget that we also need to, as physicians, we also need to take care of ourselves. But maybe knowing what we're getting into, maybe knowing that we have to take care of ourselves as physicians before, in order to take care of our, even family members and everybody else, and just paying attention to that, and paying attention to take that vacation, take that time with your kids, try and have a well-balanced life if that's possible. The difficult times will pass. I promise you, they will pass. There might be another challenge, but they will pass. And there is lesson in everything. That's one thing that I, keep learning. There is lesson in every single experience. Every single experience.
Absolutely. Such wise words. And it's so interesting. Everybody has their take on it, but they're all saying something similar. It's amazing. And it's the reason I ask is everybody's take on it, somebody could benefit from it. So I always ask that question.
Absolutely.
Thank you so much, Dr. Mitra. So for our listeners, if anybody was looking to connect with you or look you up and all that, how would they be able to do that?
So I would love it. I can be, some of the videos and everything else is on my website, but also on my YouTube channel. So my website is www.capeyemed.com, CAPEYEMED.com. And like I said, I'm in Northern California, and some of the videos may be helpful, even if you're not in California, but you're wondering, what is cataract? What is dry eye? What is this? What is that? There are some videos that explain, what the process may be, not of the actual surgery, but kind of talking to you like I talk to my patients as far as what to expect, and how to prepare. What do you expect the day of and all of that? I would love it if, your patients found that interesting, or, that would be great.
Absolutely. So do me a favor, if you don't mind sending me your social media handles, and we can just have my VA put that in with this as well. So guys, you heard it. Definitely check out Dr. Mitra. Your eyes need some love, and she will definitely take care of them. And on the flip side, if you're looking for a quality family medicine physician, look us up. We're accepting new patients, and we'd love to take care of you at Apple Valley Family Medicine. Our website is www.applevalleyfamilymed.com, and you can also call us at 304-350-1087. You guys have an amazing week. Bye. Thanks, Dr. Mitra.